Your heart is the most incredible engine you will ever own. It is a powerful muscle, about the size of your fist, working tirelessly every second of every day. From your first moments of life to your last, it pumps blood, delivering oxygen and vital nutrients to every single cell in your body. Without this constant rhythmic beat, our organs could not function, and our bodies would shut down. Understanding how to care for this engine is essential to long-term health and well-being. Think of it as the central power station for your entire existence. We often rush through life assuming it will just keep working. But like any hard-working machine, it can face problems. Some problems strike suddenly. Others build quietly over years. By learning the signs, big and small, you empower yourself to act quickly, seek the right help, and protect your life. One of the most feared heart emergencies is a heart attack. This happens when blood flow to part of the heart muscle gets blocked, often by a blood clot. Classic sign: crushing pressure, like an elephant on your chest, possibly spreading to arm, jaw, neck, or back. Shortness of breath, sweating, nausea, lightheadedness. Women may have these more than chest pain. Fast action saves heart muscle. Call emergency services immediately. Chew aspirin only if advised by dispatch. An aortic dissection is a tear in the inner wall of the body's largest artery. It causes sudden, severe, ripping pain in the chest or upper back. Risk rises every hour. Call an ambulance immediately. Emergency surgery often needed to repair the tear. Not all chest pain is a heart attack, but never self-diagnose. Heart pain feels like pressure, squeezing, or fullness. Worse with activity, better with rest. If new or severe with breathlessness or sweating, treat as cardiac. Call an ambulance, do not drive yourself. Pulmonary edema feels like drowning, needs urgent care. Hypertensive crisis causes headache, blurred vision, confusion. Lower BP safely. High cholesterol is a silent threat. LDL builds plaque, narrowing arteries. No symptoms, no via blood tests. Manage with diet, exercise, and sometimes statins. High blood pressure damages arteries, heart, brain, kidneys. The silent killer. Control with low sodium, exercise, stress management, and daily medication. Your valves are one-way doors. Aortic insufficiency means the aortic valve leaks. As it worsens, fatigue, breathlessness, pounding heartbeat. Murmur leads to an echocardiogram. Treatment ranges from monitoring to valve repair or replacement. Rheumatic fever from untreated strep can scar valves. See a doctor for severe sore throat. Antibiotics prevent damage. Prompt treatment prevents long-term harm. Non-ST elevation ACS is diagnosed by troponins, treated with antiplatelets, anticoagulants, and urgent cardiology care. Dyslipidemia may show xanthomas. Manage with lifestyle, statins, or fibrates, guided by cardiovascular risk. Section 4. When your rhythm falters, pulse and pressure problems. Your heart's rhythm is its signature beat. Sometimes it falls out of sync. Tachycardia feels like racing or fluttering, often stress, caffeine, or exercise, but sometimes an electrical problem. If dizziness, breathlessness, or chest pain, seek care. Sit, relax, try coughing or bearing down until you see a doctor. Bradycardia is an abnormally slow heartbeat. Healthy in athletes, risky in others if causing low blood flow. Causes include aging, heart disease, and medications. Dangerous if it leads to fainting, fatigue, dizziness, or confusion. Severe cases may need a pacemaker to regulate the heartbeat. AFib is an irregular, often rapid beat. The atria quiver instead of contracting effectively. Symptoms include fluttering, weakness, breathlessness. Blood can pool and clot. If it reaches the brain, it can cause a stroke. Treat by controlling rate, restoring rhythm, and preventing clots with anticoagulants. Syncope is a temporary loss of consciousness, sometimes from dehydration or standing too fast. But syncope can warn of dangerous rhythms or structural valve problems. If you faint during exercise, without warning, or have heart disease, see a doctor to rule out cardiac causes. Section 5. Hidden dangers. Clots, swelling, and other warnings. A deep vein thrombosis in the leg causes swelling, pain, tenderness, and warmth, often one calf. A piece can break off and lodge in the lungs, causing a life-threatening pulmonary embolism. Seek care immediately. Diagnosis and treatment typically include anticoagulants to stop growth and prevent travel. Anticoagulants save lives in AFib and DVT, but increase bleeding risk. Watch for unusual bruising, nosebleeds that won't stop, or blood in urine or stool. A fall or head blow can cause dangerous internal bleeding. Seek emergency help right away. Persistent swelling in both legs may signal heart failure with fluid backing up, especially if breathlessness or sudden weight gain. When the heart underpumps, veins back up and fluid leaks into tissues. Varicose veins arise from faulty vein valves, aches, heaviness, sometimes skin ulcers. Elevate legs, wear compression stockings, and avoid prolonged sitting or standing. Discuss with your doctor. Hypotension can follow bleeding, dehydration, endocrine or infectious causes, or arrhythmias, treated with fluids, vasopressors, or transfusion based on cause. Never ignore emergency symptoms. Any new, severe or unexplained chest pain, especially with shortness of breath, sweating, or pain radiating to arm or jaw, call emergency services now. Use FAST for stroke, face droop, arm weakness, speech trouble, time to call. For persistent leg swelling, fainting spells, or consistently fast, slow, or irregular heartbeat, book a prompt appointment. Build your base with fruits, vegetables, whole grains, and lean proteins. Limit processed foods, sugar, and unhealthy fats. Aim for at least 150 minutes of moderate exercise weekly, like brisk walking. It strengthens your heart, manages weight, lowers blood pressure, and reduces cholesterol. Quit smoking. Keep blood pressure and cholesterol healthy. If you have diabetes, manage blood sugar to protect vessels and nerves. Regular checkups track silent risks: blood pressure, cholesterol, blood sugar, so you can act early. Discuss lifestyle, family history, and any concerns openly with your clinician. Your heart is amazing and depends on you. With awareness and healthy habits, you give yourself the best chance for a long, vibrant life.